Even the air we breathe is more likely to harm black people. Southern states have historically had looser environmental protections. As a result, many have manufacturing facilities and factories that produce toxins that negatively impact the health of those living and working in close proximity. Those toxins have been linked to leukemia, lymphoma, and breast cancer. Analysis conducted by ProPublica shows that minorities are 40% more likely to experience exposure to cancer-causing industrial air toxins than whites by living in what they consider sacrifice zones. The cancer risk among black people living in those areas is more than double that of white people. Joining us now is the Vice President of Environmental Justice, Climate, and Community Revitalization for the National Wildlife Federation, Mustafa Ali. Mustafa, you know, the ProPublica numbers were just shocking to me. I want you to just give us just a pullback and give us a kind of big overview of why black people continue to be more exposed to environmental hazards than everybody else in this country.
Yeah, well, you called it out. We live in sacrifice zones. Those sacrifice zones have been created by policy. It's been created by redlining. It's been created by restrictive covenants. It's been, it's been created also by the zoning that happens, where they will make our communities, industrial and residential at the same time, where you would never find that in white communities, especially middle class and upper middle class white communities. And you also find the lack of enforcement happening there because we delegate to the states the responsibility. So we have all these different dynamics that come together. And in many instances, our folks are breathing a toxic soup that literally begins to just destroy the body, destroys the spirit, and also destroys our mental capacities in many instances.
The Trump administration rolled back over 100 environmental protections. How would you score the Biden administration on his administration doing its best to reestablish those protections?
It's been slow, but they have been making some steps. Around air toxics, not as much yet. When it comes to the pollution that's been coming out of tailpipes of cars and trucks, there's been some movement in that direction. Putting together the White House Environmental Justice Council was incredibly important because they shared a huge set of recommendations to the Biden administration on the steps that need to happen. Charles, in relationship to our communities, we can't wait. We know what the science says. We know what the data says. So folks just need to begin to move forward on getting the right types of actions in place, the statutes and laws that need to be strengthened, the enforcement actions that have to happen at a higher level inside of our communities. So a year in, they need to speed the process up.
What is the solution here? I understand why the Biden administration on some level would go for the easy target, the low-hanging fruit. These cars are new cars. They have to be built in the future, right? So you can put a regulation on something that doesn't exist right now, and in the future it'll be built to match the regulation. But in the case of the proximity of black people to toxins, this is very much about urban planning. This is about where people live, where they may have mortgages. It is about decisions made 20, 30, 40, 50 years ago in terms of where highways were put, in terms of where waste facilities were put. It is where people allowed industries to build giant factories. It's not very easy to undo these kind of oppressive structures in our neighborhoods. How do we deal with that?
Well, one thing that we can do is make sure there's an all-of-government approach. Whether it's the ProPublica study or a number of others, we know where the hot spots are across our country. And that means that not only with the Environmental Protection Agency, but with HUD and with CDC and HHS and a number of other players, we can leverage both their statutory authority, we can leverage the resources and the capacity that's going to be necessary to address these things. The EPA is also, along with some of the other health agencies, going to have to get focused on cumulative impacts because in many of these communities, they are literally surrounded by dozens, sometimes even more than that, sets of polluting facilities that are causing a toxic loading to happen inside. of each and every one of these communities. So folks are going to have to actually begin to get very strategic. They're going to have to make sure they're leveraging the resources and the statutory authority that exists. And then we also have to work, unfortunately, and I just watched the segment before, we're going to have to also work both with folks on Capitol Hill and in state houses to strengthen the sets of actions that have to be happening on the ground to our most vulnerable communities.
Is money also part of this? I mean, can people be incentivized to move by people writing checks? I mean, if you know, these are data points, right? So if we know there's a cluster where people are getting cancers at a higher rate than anybody else, twice the rate of white people, you see where those dots are on the map. Can somewhere between the government and the industry that is causing the cancerous pollutions, can there be some way of getting people money in order to move out of those places?
Well, we have to relocate folks. It's almost like with the climate crisis. We know there are certain places that people are not going to be able to live in the future. And dealing in this present moment with these impacts that are happening, we have to begin to be able to relocate whole communities, because in many instances, folks want to stay together. Mossville, Louisiana is an example of black folks not getting the same amount of money to be relocated as the white folks who are even further away from the contaminating facilities that were impacting the community. So once again, if we're serious about protecting black lives, then we've got to make sure that the resources are there. The second part is that those facilities, sometimes there are actually international conglomerates that are actually poisoning folks, that they have to be fined and that they have to be a part of the relocation of folks who want to get out of these sacrifice zones.
Yeah.
And if we're not going to do that, then we're just leaving people in a dangerous situation.
Mustafa Ali, I'm going to take that as you endorsing write the check. Thank you for joining us tonight. I appreciate your time.